In the year 1998, when King published an article in the journal Diabetes Care, he articulated for the very first time that India would accommodate the largest number of patients with diabetes, approaching a number of around 20 million. The article had also prophesied that the number of patients with diabetes in the country would stand at 57 million by the year 2025. This prediction has not been false, but has proven to be an underestimate of what was to happen. Today, in the year 2018, we stand at the precipice of reckoning. India is faced with a galloping diabetes epidemic which is progressing at a speed which challenges the meanest and fastest on the F1 racing circuit. There are now an estimated 65 million patients with diabetes in India, and this number is projected to explode beyond 85 million by the year 2030, perhaps much more. While diabetes in urban areas is of mammoth proportions, in places like Cochin having figures in excess of 22% of the population and Chennai at 20%, the epidemic is sweeping like a cyclone across the subcontinent and engulfing rural areas as well. And it approaches terrains which were previously perceived as untouched. What is more concerning is that the complications that occur would end up being more damaging to the individual and society. Now visualize a situation that at least 5 lakh or half a million of your 65 million patients with diabetes have at least a toe or a limb that has been removed. An amputation or a loss of a limb, which is a result or a combination of nerve damage, large vessel blockade, or poor footwear practices in patients with diabetes. This amputation would affect not only their morale but also their physical balance when attempting to walk, and would lead to a number of those in the agrarian or laborer class to become totally ineffective in their day-to-day work without proper rehabilitative therapy and artificial limbs. The fact is that as early as the year 2000, Luceni had pointed out that if a patient with diabetes had one small blood vessel complication, which could include nerve damage, retinal damage in the eye, or early kidney disease, the cost of treating diabetes goes up by 1.5 times. If a patient has one large blood vessel complication, that is a heart attack or a brain attack, the cost could go up by twice the amount that would be normally spent for treating diabetes. However, if a patient has both one small vessel and one large vessel complication, the cost of treatment goes up by almost 3.5 to 4 times that of the baseline. This is not acceptable for most socioeconomic classes in this country, and the impact on families and a society as a whole would be quite devastating. So as a community, how should we react? On this World Diabetes Day of 2018, let us hold hands together and work together on a motto which transmits the right message. That motto is prevention. As has always been the saying that prevention is better than cure, where should we start? Well, it has been shown that the earliest age group to target would be school children. As parents, teachers in schools, and caregivers for children, we should encourage all children to take up one outdoor sport or game and play it for at least 45 minutes a day. A few minutes of this physical activity in a day will not interfere with regular academic activities or studies. In fact, it has been shown that it may improve grades in schools. These few precious moments will prevent about 50% of diabetes later on in life from even happening. Our children will therefore have a healthier future, and India will have a healthier community. Secondly, in those who have already had the problem of diabetes, a combination of regular monitoring of glucose once a week, self-examination of the feet and proper foot care, a disciplined diet, 40 minutes of exercises or walking, and a visit to the doctor once in 3 months will prevent 75% of problems that are related to diabetes. Therefore, on this day, November 14th, 2018, let us all hold hands and wage a successful battle against a disease which needs to be addressed most urgently. This is your battle as a community and not just the responsibility of a doctor. Hoping and wishing you all a healthy life ahead. Thank you.